Hello, 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 and welcome back to another episode of The Shadow Side with Safrianna. Oh, I am back with a return guest from season one, my dear friend, Dr. Matt Van Auken, and we are going to be talking about some spicy topics today. Today's episode, I entitled Make America Sick Again, which admittedly is a little clickbaity. I get it. And it's very accurate because where we find ourselves in the intersection of time, space, and humanity here in the United States, we are making some questionable decisions. So, we're going to get into how that impacts us today and give you some actionable steps to take to reclaim your health at this point in time. So, Dr. Matt, if you would be so kind as to introduce yourself.
I'd be happy to. Thanks for having me back, Safrianna. So, Dr. Matt Van Auken. I'm a medical doctor, physician out in Portland, Oregon, or I should say, centered out of Portland, Oregon. I practice Ayurvedic, integrative, and lifestyle medicine. My practice is the Buddha's medicine. Check out the website for our video viewers. The link is below the purple bar with my name. It looks very nice. And I see folks all over the country. I see folks for one-on-one care, and then we also have some ongoing seasonal preventive health programming available to everybody as well.
I love that. Seasonal preventative health stuff is...
Yeah. We can circle back to that. We can circle back to that later. We got some how are we making ourselves sick topics to talk about.
We sure do. Oh my gosh. So in case you don't know me, I'm Safrianna Lughna, and I am a licensed clinical professional counselor turned transformational mentor. I'm an international best-selling author, a druidic priestess, and my goal here on Earth is to help us reconnect with the planet and our bodies and our health and our wellness just in a out of the system way. So I love people like you, Dr. Matt, who are already breaking that Western dominant system to say, there's another way. There's another way to approach our health. There's another way to approach our full body being, not just this Western medicine way.
Yeah.
So
back at you, by the way.
Thank you. So as we jump in today, I wanted to really look at what is happening. We are recording this at mid-March 2026. So we have been in Trump administration number 2 for well over a year now. And we have seen some major policy changes that have had and will continue to have an impact on our environment, our access to healthcare, and our access to good food and water. Yeah. And I really just want to jump into that today and start to break down, because a lot of people aren't aware these things are happening in the background. Unfortunately, there was some really good talk. We're going to remove food dyes from food. We're going to get rid of some of these really harmful pesticides. We're going to make the environment better. We have done everything but that.
Yeah, literally the opposite in every single one of those bullet points. The opposite of the thing that the bullet point said has happened.
Yeah, and it's alarming. And so I kind of wanted to break down these 3 major domains, we'll call them, of our environment. So our environmental safety, our health services, our medical care, our prescriptions, and then also just our access to food and water, and kind of talk about what has happened and why these things are each so essential. So I'll just
we'll
jump
spell it
in.
out, though hopefully we don't have to. It's one of those kinds of things.
Yeah, so we'll start with the environment. And I was just doing some additional research to make sure I'm up to date. So some major things: air quality and climate change protections have been majorly rolled back.
Yeah.
So one of the biggest things is that the EPA announced that it's no longer taking into consideration the health benefits of reduced air pollution in policy and how it's moving forward.
Yep.
As an Ayurvedic practitioner, the importance of the breath. Can you speak to the importance of the breath and the health of the air that we take in?
Oh yeah, it's central. It's the breath is life, right? That is not unlike in the Chinese, Japanese traditional medicine spheres, and frankly other vitalistic spheres, ancient Greek medicine, Unani medicine, a lot of indigenous medicine systems. Breath, prana, chi, ki, whatever sort of sacred word you might want to attribute to it, all of those, that terminology is intentional, right? If we're not breathing clean air, we're not living healthy lives. This is perhaps no more obvious or standout than in situations where, like, folks who have been smokers for a very long time develop chronic respiratory conditions, COPD, chronic obstructive pulmonary disease, whether it's a chronic bronchitis type or some other type, lung cancer kinds of situations. And we actually see not dissimilar outcomes in people who live in excessively polluted areas of the planet, right? Particularly underdeveloped but highly industrial parts of the world where there's a lot of coal burnt, or, excessive amounts of, industrial emissions from whatever manufacturing processes are going on. We see actually really similar respiratory health outcomes in those two cases, right? Whether you're smoking directly, whether a person is putting the smoke directly into their body by choice, or whether it's entirely unintentional and a factor of climate policy and industrial policy in the locale where they live. It could not be like, this is actually the perfect place to start, Safrianna, because there's nothing more universal to the human experience, whether we're talking about health or whatever else, than breathing.
Exactly. It is the foundation. Ugh.
It is the ultimate foundation, right? The first thing we do out the womb is take a breath. And if it doesn't happen, everybody present for the birth panics and craps a brick correctly.
Right. Yeah.
Completely appropriately. If we're not breathing cleanly, we don't have health. We've also seen, even here, that sounds like, that almost makes it sound as though the United States is an exception. The United States is not an exception, right? It's been known for decades that in places where there are higher levels of poverty and greater degrees of underservedness in various social and political ways, rates of, for example, asthma in children go up dramatically, right?
Yeah.
Kids who are exposed to more vehicle exhaust are more prone to developing asthma. It's the same concept, the same principle, right? We keep seeing the same thing over and over. We keep not learning the lesson. And
or
go
the
ahead.
billionaires just don't care about the lesson.
Well,
Thing.
that's part of the lesson. Yeah, that's part of the lesson. And that's literally the point I was about to make. Because as we get into talking about policy around, forever chemicals and regulations or lack thereof on those, and excuse me as I cough, pesticides in our food supply, or whatever else we might be discussing. What we're really talking about is, and I'm going to use this word intentionally, but I promise it's not meant to be in a cringy way. What we're talking about foundationally is fascism. And I don't mean that in the, like, necessarily in the political mudslinging sense. I mean that in the sense of the literal economic sense of the word, right? Fascism foundationally is about the unholy marriage between industry and corporate interests and federalism.
Yep.
And when there is an unending revolving door between those two spheres of, the human macro structure, what invariably we wind up doing to ourselves as a species, and frankly to our environment and to the ecosystems that we're apparently reluctantly a part of, is we just dismantle and destroy them.
Mm-hmm.
And of course, the impact of that process on health is going to be deleterious, to put it mildly.
To put it mildly, yeah. There's so many rollbacks that are happening right now. One of the big things is the mercury and air toxic standards, the MATs, were rolled back. And This literally has saved over 10,000 lives per year in the past.
Mm-hmm.
Over 10,000 lives in the past. So with these rolling back, this is basically reigniting the flame in the coal plants. A lot
Yeah.
of the rollbacks that have happened are to extend air pollution limits for
Yes.
the purpose of allowing coal plants. And I love that you brought that up, specifically coal, and how industrial cities, they have more of these issues. So as we roll back more of the protections, these issues begin to impact more neighboring towns and cities and states, and
Yes.
eventually like more and more of the world. You also brought up the forever chemicals, and that's another big environmental thing that I wanted to talk about, because it's it's impacting our drinking water,
Mm-hmm.
it's impacting employment, it's
Mm-hmm.
impacting our crops, it's
Mm-hmm.
impacting so many like regulations that give us higher risk of pollutants. So
Yes.
the quality of our air is going down, the quality of our water, the quality of our soil.
Right. All of the above. All of the above. And we don't have, we already know, even with an incomplete data set, right? The impacts of these compounds on human and non-human animal health, and frankly, plant health, have not been fully fleshed out. But the impacts we already know that they have can be profoundly detrimental. These are variably neurotoxins, um, fertility crushing endocrine disruptors. They are, in many cases, carcinogenic, right? They increase cancer risk. And again, there's a potential host of severely detrimental effects that these compounds can and apparently do have on living bodies that we don't fully understand, because industry interests have similarly, um, to other bad things they've impacted, have similarly kind of put the kibosh on efforts, especially at the government level, to thoroughly evaluate what what these things can do, what these things can and will do. And that's really scary, right? To quote one of the villains of the early aughts, Donald Rumsfeld, there are known knowns, and then there are known unknowns, and then there are unknown knowns, and then there are unknown unknowns. This is one of those things that's like an unknown known, right?
Right.
We know these compounds are problematic. We know they don't belong, bare minimum. They're not made in nature. And now, not everything that's synthetic is necessarily horrible, right?
Sure.
But we know that these compounds do not belong in the human body. There is no established uh, medicinal or positive health implication for their use
Right.
that we know of anywhere, and there are some detrimental health effects already established, but our understanding is incomplete.
Yeah.
That's really bad. It's really frightening, and it's just another one of those. It's a little bit it's a little bit of like Flint, Michigan revisited, but on a nationwide scale.
Right. It's very alarming to me how many regulations, specifically regulations, are being rolled back, the protections being rolled back, that when you look in the fine print, like, it is okay to impact our water and our air and our food quality. Like, that's essentially what they're saying. And this is, yep,
Yes.
we don't worry about that. In fact, we make less money by helping your health. So we don't care. We don't care about that.
Don't you worry about that.
The
Don't
shareholders.
worry. Don't worry about that.
We got
Yeah,
to worry about
well,
the shareholders.
and now we're harkening back to the first episode we recorded together, we have to think about, you're being, Safrianna, I have to say, I'm disappointed. I expected better of you. You need to be taking the shareholders and the executives' fees into account. It's not something I see that we're doing enough.
I
All the
cannot.
crying billionaires I've seen, the interviews I've seen from them, they've really swayed me on this. They're right. We should be rolling back all of these regulations because they want another yacht toy.
Yeah, they do. They really, and they're gonna get it, is the
And
scary
I'm
thing
gonna
at this point
have
in
it.
time. God. And they're going to do so with very unclean energy and all of the unclean supplies, and just continue to destroy this planet. And I'm a druid. Like, the
Yeah.
environmentalism it's a hot button for me, because we talked about breath being the foundation of us being alive. The planet's going to survive.
Yeah.
Unless we bomb it to hell and back, the planet's going to be fine. The trajectory that we are currently on, we as a species are not going to be fine, because these
Right.
regulations keep our atmosphere in check. They keep the environmental change, the climate change from accelerating. It is currently accelerating. We were
It
seeing
is.
a decrease during the height of COVID. We saw environmental stuff like getting a little better again. And I was like, yeah, we got this. And now we have gone full accelerationist. And I think that
Yeah.
that is a lot of the last 2 years, with a lot of
Yeah.
these things being rolled back.
Yeah.
But it's just, these have huge long-term impacts.
That they do.
And
And the effects are what exactly the long-term effects will be. Like that's a story that has yet to be written, right?
that
There's
that story has been written. It's called The Wind Sings Sorrow. It's my
oh,
novel.
fair enough.
It's a post-apocalyptic climate fiction.
I disregard what I said. The story has been written. It's called The
It's
Wind Sings
not
Sorrow.
good. It's not what you want.
It's not good. No, and actually, I think I can't remember who the author was, but Silent Spring, right? It's that story, but who knows exactly what the what all of the nuances of that tragedy look and feel like, right? The more we decimate our our ecosystem interweb, the more we reduce our own species likelihood of survival and most certainly of thriving, right?
Yeah.
I think frankly Mad Max might be a little bit optimistic,
At this point.
at this point, if this is the road we continue to go down. And well, I suppose that's the entire point. I don't think we need to go more doomer than that. That's probably enough.
It's
That's
pretty
probably enough
it's pretty
doomerism for now.
doomy. But yeah, I want to jump into the bridge between environmentalism and our food,
Yeah.
because one of the big platforms that RFK Jr. ran on, and I know I have people in my audience, I have people in my world who were so pro RFK Jr. I still don't understand. I admit that. I still don't
Yeah.
understand. I was very willing to listen. And just like when Trump was reelected, I said very firmly, I will wait and see what happens. I am willing to give the benefit of the doubt. I will say I could be completely wrong. I'm willing to eat that humble pie. I'll be wrong. I was not wrong, and I'm upset about it. But one of the big things that RFK Jr. was running on was pesticides, because
Yeah.
pesticides such a huge impact. And I'm an organic farmer. I homestead. I'm not really a farmer. I'm a homesteader. There's a difference. Farmers provide for lots more people. I provide for me and a small group. But pesticides, oh my God, like, what can't I say about them? They're so awful. They can cause brain damage and cancer and hormone disruption, all of the things you've already listed with all the other stuff.
Yep.
But we have not only identified over dozens of high risk pollutants, but we gave them new life by rescinding the protections on them. So
Yeah.
the policy, the platform was, we're going to make these more regulated. We're going to remove more of these bad chemicals. And now know, in fact, we have weakened or rescinded the regulations on them entirely.
Yeah.
The
Make
implication.
America glyphosate again.
Say more on that.
MAGA. Well, Joe, glyphosate Roundup is probably the most well known of the pesticides. Certainly not the only one that's used. Formerly Monsanto, currently Bayer, which
Oh,
bought them. Now look, aspirin, great. Glyphosate, probably less great. Actually, definitely less great. This is one of those, sort of like this is one of those like nationwide fell for it again award kinds of moments, right? Not that we should expect, like we can have two different conversations here. One is about RFK Jr., who is like, when somebody shows you who you are, believe them kind of thing. Like when somebody like hits a baby bear with their motor vehicle and then loads the baby bear into the car and then proceeds to eat it. Um, we should question that person's cognitive proclivities, maybe is the way I want to put that. Um, RFK at one point, it's a really disappointing story because I think at one point RFK Jr. was a very hope-inspiring environmental attorney and did some really fantastic work. And then something happened to RFK Jr.'s brain that seems not to have been very good. And I don't know what that is. Maybe it's all of the testosterone he appears to be injecting. Because no 70-something-year-old is going to have that physique, no matter how much that person works out, without some really significant,
some
uh,
chemical aid.
yeah, some really significant chemical aid. That's nicely put. Some really significant chemical aid. Um, there's a whole conversation we can have there, but I don't actually think that's the point here, right? I think the ultimate point is probably twofold. One, RFK is unfortunately just as corrupted by that's the same sort of unholy matrimony between business and lobbying interests and sort of power at the federal level that seemingly the rest of this current regime is. And granted, like there's lots we can crap on Trump 2.0 about, and I think that it's right to. And also, it's not like this hasn't been, sort of this. This is the crescendo of like decades of cumulative, really poor, you really like humans at the bottom of the barrel, bottom of the priority list, kind of policy choices that we've been making in this country collectively. We haven't had any say in that. It's all been industry leaders and basically the Epstein class.
Yes.
Effectively for decades at this point. That's really what this story is about, right? So the point I want to make is twofold. One, RFK previously was a very hope-inspiring environmental attorney. Currently, he and his uh, board of influencer weirdos is taking are taking a lot of industry money, specifically meat, dairy, and
Yep.
egg lobby money, like hundreds of billions of dollars of money, to halfway revamp nutrition guidelines, right? Interestingly, the written nutrition guidelines don't even align with what the re-illustrated food pyramid is like.
That's very
Um,
interesting.
and there are some good like they're emphasizing, well, like more fruits and vegetables. Okay, great. And then they're putting like factory farmed meat and dairy and eggs at also like same tier basically. And it's the only reason that happened is because of all the money that they're taking um from those lobbies. And
Yeah.
and actually they've been transparent about that. Like we in a weird backwards way, to their credit, they have copped to that, which like like, what planet am I living on right now? They're just like out and out saying like, yeah, we took this money. Yeah, there was industry influence on you know on these guidelines, and like what, like people are good with that. Like, it's
Yeah,
wild. And then the other piece is, RFK is cucked to Daddy Donnie. That's
truly.
that's what that boils down to. I don't think it was his call to. I mean, frankly, it seems like he's been mostly silent on the subject of, you know, rollbacks of regulations on glyphosate and other pesticides. Um, but it's because he's a tool.
He benefits. He
Uh,
gets to
he
directly benefit. So
Well, yeah, well, he just benefits from being a tool. Yeah. He doesn't necessarily benefit from, I mean, maybe he does, who knows? He doesn't, I don't know if he directly benefits from the rollbacks on the pesticide regulations, but he definitely benefits from being a mouthpiece in the way that he is.
yes. And
And,
that
yeah, go
mouthpiece is an
ahead.
important term
Yeah.
because I think RFK Jr. really has a power of charisma for many people. They feel
Mhm.
like he is representing something about them, right?
Right.
And he said a lot of good things. We're going to make sure our kids aren't harmed by these pesticides. We're going to remove these food dyes from food that are disrupting and causing allergies. But it's the 180 turn that's like, okay, my benefit of the doubt is lost. It
At the end of the day, RFK was always part of the same elite class, the same, like the same millionaire, billionaire, like born with a silver spoon in their mouth, like could not possibly go anywhere but upward, even as they failed. Kind of class of folks that, like, frankly, most of the people in power are.
yeah.
And that, you know, I can't imagine being a part of that sort of echelon of society and not being really detrimentally influenced by effectively only being surrounded by what amounts to like an echo chamber,
Right.
and what amounts to like just basically like a cast of individuals that are only ever thinking about accumulating more wealth and power for themselves. And I'm sure there are some exceptions, right? Like, I don't want to overgeneralize to like every human being, right? But living in a world where 60% of the world's billionaires inherited their wealth and did literally nothing to
Yeah.
earn a drop of it. Like, kind of, what did we like what are we expecting from these folks? Are we really thinking that they're going to understand what it means to live and function as a regular human being, just sort of surviving and trying to find ways to thrive day to day? Is that what we expect?
When people
Um,
don't know the word groceries
right.
and
Yeah, when
yeah.
Dr. Oz goes out to like a supermarket and talks about like the price of crudité, uh, which is a word that most Americans have never heard.
I was like, that's new to me. I just know that sounds
Is
real
he talking
fancy.
about shellfish? What is that? He's holding a celery stick. What are we talking about? Like, that's the world we live in, and we have to see reality for what it is. This is again, and these are conditions brought about by the grossly excessive influence of industry and the um, gross and profound underregulation
Hmm.
of every single last thing these corporations do.
Yeah. Yeah. And I know we could lay out every single detail of everything that is happening. And as Dr. Matt pointed out, it's a lot of doom. It's a lot of gloom, right?
Yeah,
So I want to just highlight some of the main big things, and then I want to get into how do we help navigate these things,
yeah,
because
yeah.
funding's being cut all
Yep.
across the board. So many people have been laid off from these organizations, from the CDC, from the NIH, from the FDA, from Medicare and Medicaid. There have been
Oh,
layoffs
yeah, we didn't even talk about that.
and grant cuts. And so obviously, like just that, we know people are going to lose access to healthcare. It's
Right.
happening
It's
already.
happening right now.
It's happening right now. We know that there were rollbacks on prescription drug price protections, which is
Yep.
really funny because Trump was coming out saying, we're going to cut drug prices by 300, 400, 600%, which literally means
1800%. You're gonna pay 1800% less on your insulin.
okay. So we've rolled back the protections that let people pay $2 for their prescriptions.
Yep.
And no, prices have just gone up on them. So we have massive like health care access issues happening at a
Right.
time when the environment and our food and our water is being impacted. So, right? I feel
Yeah.
like a heavy side on this episode and made little grimaces and more like scared faces than ever before because this
Yeah.
is big stuff. This is, again, the
This is serious.
foundation of our life.
Yeah. That's
And
accurate.
we've removed ourselves from like the World Health Organization and the other organizations that try to maintain global health. And if there's one message I want people to walk away with, it is this: we need to remember as a species that my health, your health has a ripple effect on the health of people around us. And the
That's
health
right.
of a country has a ripple effect out onto the health of the rest of the world. So what we're doing in the United States is not just impacting us. It's impacting everywhere.
Right. And at the same time, it is impacting us profoundly. Access to care, as you just pointed out, has in the modern era, I think, never been so tenuous.
Yeah.
The premiums have spiked every which way, right? Especially on in the ACA marketplace. And that has I wrote an entire blog series about this. That has an outward ripple effect on the remainder of the private healthcare, private health insurance marketplace, right? Premiums are going up across the board. I think the average last I looked, and it's been a couple months since I checked, but the projections were like, 75% or something crazy like that. Like that was like the mean. There have been some instances where, like upfront costs have skyrocketed by like 300% for individuals and or families. There are more and more instances of non-coverage or under coverage, meaning that even with a healthcare plan that on paper theoretically looks good comparatively, people are spending more out of pocket for things that used to be covered and or should be covered because there's legitimate medical necessity. And more, the input, the expertise of legitimate credentialed healthcare providers who, generally speaking, genuinely want to do right by their patients is being questioned and second guessed and or disregarded.
Yeah.
And the result is a sicker and sicker population, right? The one segment of the economy where jobs have been added the last several months has been healthcare, and primarily healthcare in the um, not quite so niche anymore space of attending to the elderly and the infirm.
Mm-hmm.
And we're going to have more and more and more people falling into that category so long as we're not attending to our environmental, our preventive health, our universal foundational health needs. And as we have a population that is aging because nobody can afford to have kids, slash, fewer people want to have kids because the environment and the planet are taking a nosedive, and because it's so dang expensive to live, right?
Yeah.
Highly sympathetic positions. No, I
Yep.
could have kids. Also, trying to buy a house right now is impossible. Also, the job market is trash. Also, the environment's a disaster, and I don't know if the planet's still going to be here in 5 years. Also, I mean, that's again, I'm being a little humoristic, right?
But this is the shadow side, baby. Like
Yeah,
this
fair
is where
enough,
we're
fair enough.
at.
Yeah, fair enough. That's a slight exaggeration for effect, but not
Not that
always,
much
not by that much.
exaggeration. Because I mean, just look, I know I've talked to some friends out in Oregon who have said that the weather this year is different. Here in
Yeah,
Maryland,
it
it's
is.
been nuts. We have been going from like snowing to 70 degrees within 24 hours. And
Yeah.
this is just getting started, and the fact that it is ramping up. Yeah, like why would you want to have kids and put more out into the labor force when in another 10 years what's the weather going to be like?
What's the weather going to be like, and is there going to be like the a legitimate question we have to ask is another question we have to ask is what is the impact of artificial intelligence going to be on the workforce and the like available jobs? We legitimately don't know, but right now it's not looking great.
And that has an impact on the environment because those data centers, I'm already
Oh,
seeing. I have a friend whose electric bill went up by electric and water bill went up, but her electric bill went up by like $300 when a data
yep,
center suddenly opened.
that's
So
right.
we're having environmental impact, economic impact. Economic impact has health impact. When you don't have
Yes.
the economic status to go get, like, I'm going without health insurance. I've been without health insurance for 2 years.
Yeah.
Knock on wood, I've been okay and managed my things holistically and been able to then take money from my pocket to hire individual providers, someone like you or another counselor or whomever, a nutritionist to individually target things.
Yeah.
But not everybody has that available, and not everybody can continue to afford as prices go up because of these regulations and rollbacks and whatnot that are happening. And
Right.
the AI regulation is a big thing that plays. I'm glad you brought that up because that does have a
Yeah.
big too.
It does. Potable water use through the roof in places where there are AI data centers, just to keep those, just to keep all the servers, cool. The amount of steam that those places are emitting.
Right. And then there's that environmental impact again. We're accelerating everything right now. So let's talk about how to decelerate some.
Yeah. Let's.
I wanted to jump into, you had mentioned that you do, and then I just want to jump into like individual tips, tricks, etc. But you had
Yes.
mentioned seasonal preventative programs that you do, and
Yeah.
I just wanted to
Yeah.
hear more about that because I'm like, I hear the word seasonal and I'm like,
Ooh.
yay, ooh,
Yeah, right.
I'm intrigued, tell me more. But also this preventative health, because it's hard to prevent health issues when the environment itself is presenting a health challenge.
For
But
sure.
obviously, there are things we can do. So I'd love to just hear a little bit more about that.
Definitely. Yeah. So I actually, not quite a week ago, just formally launched a new endeavor that we call the Living Seasons Project here at the Buddha's Medicine. And it is an Ayurvedic seasonal preventive health and sort of self-directed self-care program that is designed to meet the needs of just about everybody, right? In the Ayurvedic system, there are 6 seasons we cycle through every 61 days. The next one actually starts, as of the time we're recording this, tomorrow, the spring equinox. But there's a 2-week transition period at the end of the outgoing season and the first week of the incoming season we call the Sandhi, which is a really rich time to be sort of making some gradual shifts, right? Moving from changing behavior and lifestyle in subtle ways that help maintain balance and find well-being as we move from whatever the nature of the outgoing season is into the nature and the quality of the incoming season. And there's quite a significant shift that occurs, as I'm sure you know, as a Druidic priestess, from winter into springtime, right? It's potentially the most dramatic shift of the year.
Arguably, yeah.
Um, Arguably the most dramatic shift of the year. And in Ayurveda, there's much written about this. We call this Ritu Charya. It's Ritu meaning season and Charya meaning like conduct, behavior, those aspects, right? How one moves about their season is basically what Ritu Charya means. And so this is effectively a lifestyle medicine program that is aimed at taking evidence-based lifestyle medicine and optimizing that for each of the 6 seasons of the year, and then weaving in more sort of classical and traditional Ayurvedic wisdom and lifestyle on top of that or into that, right? Embedding those things together because they do very much go together.
Yes.
And the idea is to make all of that and make more of the work that we're doing here at the Buddha's Medicine more accessible to more people
Yeah.
at sort of a you know uh, just in more ways, right? Greater and
Multi.
greater access is the idea.
Yeah. I love that. I love everything that you just shared. There's so much wisdom just in that. Just the fact that you designed this program and people knowing that we have these seasonal transitions. I
Mm.
think it's going to be very interesting as time moves on. I'm curious how Ayurveda will account for climate change in our season.
Yeah.
And I know that there are Ayurvedic responses too. Cold, colder, cooler, wetter, hotter. Like there are things we can
Yes.
do diet with our diet, especially
Yeah.
our breath and
Yes.
our movement to account for these things. So that is amazing. Go check out the Buddha's Medicine and see what Dr. Matt is doing because living seasons is for your health is just like I'm so nerding out over here. Like this is amazing. But aside from diving into a program, obviously, which not everybody has the bandwidth to do, what are just some immediate things we can do to help ourselves navigate these environmental impacts that are happening, as well as making subtle dietary choice shifts as we're able to just try and support our bodies with all of the things that are
Yeah.
out of our control?
Right.
We can't change. We can go rally and vote and spend our money where, vote with our money. We can take these little actions and speak up and write letters and canvas and do all of the political things and activist things to try to turn the story around. And I'm all here for that. But as individuals, what can we do to support our health right now?
Awesome question. I would say start by finding community. Um, there is one really important aspect of health that we haven't spoken about directly, but that is um, really well established in the lifestyle medicine community. Uh, Not to be redundant with my words, is finding community, is finding healthy social outlets,
Mm.
right? Finding neighborship, finding friendship, finding companionship in a variety of different ways. Historically, how have humans sort of best weathered crisis? It's been by banding together, right? We're a social species foundationally. That's
Mhm.
what we do. That's how we get through. We do it by coming together in moments like this, locally, statewide, nationally, right? It's one of the reasons I'm so thrilled to be connected to you because it's, you know what, like I consider you and I to be in community together, right? And it's really meaningful. It's a source of hope, it's a source of inspiration. And on a local level, it's really like, especially if people are doing things like growing food or, um, whatever, they've got their own chickens or something, whatever it is, like that's people can share, they can trade,
Yes.
right?
Yeah.
They can support each other, they can be there for each other.
Mutual aid.
Um, Mutual aid, that's where it's at. Um, and uh, and there's no more potent or powerful response to rot at the federal level uh, than brilliance and togetherness and hope and resource at the community level,
Yeah, they want
the
us
local
isolated.
level.
If we're
Yeah,
isolated, we can't organize, we can't take care of ourselves.
absolutely. That is, new feudalism, same as the old feudalism, right? Divide and conquer sort of mentality. Uh, and then, another one I would say, just to name two, and then I want to hear your answer to the question. Another one would be, um, lean on, like, as far as like nutrition goes, like lean on staples. Eat as seasonally as you can. Keep your expenses low that way. Buy shelf-stable staples, whatever whole grains you tolerate, whatever legumes your body does well with, spices, pieces like that. Keep those on hand. Make regular use of them, and share with your neighbors. There's no healthier way to eat than like down to earth, directly from the earth. You know, simple and non-ostentatious.
Yes.
That's where it's at, right? Simple and non-ostentatious food.
Yeah. No, I love that. And that would be one of my biggest things, is how you fuel and feed yourself
Yeah.
is so important. But another little piece I'm going to throw out there from the spiritual angle, because we have
Mm.
seen that we can influence things with our energy, is
Mm.
even if your water isn't the cleanest and your food isn't the cleanest, can you say some kind words over it? Can you invite your beverage to nourish you? Can you imagine it hydrating your cells? Can you thank the food for how it's going to provide you with building blocks so that you can keep strong, right? There is absolutely a mental and energetic component that we can layer into the food, that even if you're eating a packaged processed food, you can lift the energy of that up simply by, you can call it praying, spelling, manifesting, whatever you want to call it, but like being in energetic relationship with what you're putting in your body. That includes your,
Amen.
yeah.
Yeah,
And
that includes your breath. Yes.
yeah, and bless your breath, right? It is your
Yeah.
foundation. I think that as consumers, we also want to vote as much as we can with our money. Most of us out here right now are not in the billionaire or millionaire class. We are seeing the pinch right now. And so, where can you vote with your money to say, I'm going to support this?
Right.
I'm going to support this local company. I'm going to go buy from a local restaurant instead of, like, if you are eating out, maybe you support a local restaurant instead of a chain. Maybe you are going to places that are not using as many plastics. Maybe you are reducing how much plastic you buy. Just voting with your money in general for your health. And I will say, I really tried in 2025 to go plastic free, and it was impossible. It was impossible.
Yeah.
So it's like, where can you just reduce something a little bit? Where can you just make
Yeah.
a swap that might save you money, that might save you some forever chemicals? And yes, local, local, local. The more local we get, the better.
Yeah. The more local we get, the better.
Yeah.
The more local we get, the more we share, the better.
Yes. And tending your environment.
Yeah.
Like, we drag in a lot of unhealth from just the outside world that we can clear in our environment, that we can declutter our environment. We can get rid of things that we know to be harmful to us. You know, again, making swaps and reducing our level of consumerism, I think, are all going to move us towards health.
Right.
Yeah.
Yes. 100% endorsement of all of that. Most especially the gratitude, mindfulness, and energetic presence piece.
Yes.
That is the part that I think each of us has the greatest degree of control over.
Absolutely.
And we owe it to ourselves to take that power into our own hands and use it well
Yeah.
for ourselves and for each other.
Yes. In a time where it feels like the quote unquote powers that be are just doing everything to make us unsuccessful and unhealthy and miserable,
Yeah.
we deserve to reclaim and liberate ourselves and not give them our time and attention as much as possible, so we can
Yeah.
focus on what's right for us and our health and our longevity, our joy, all of it.
All of it.
So, Anything else, Dr. Matt, that you want to share today? Any words of wisdom or just things that you want to leave people with after this conversation of both seriousness and empowerment, right?
Yeah, totally. Yeah, actually, the note I think I would like to leave everybody with is, in spite of all that, positive attitude, right? Positive mental attitude, to quote the Bad Brains. We got that PMA for my gutter punkers and hardcore people in the audience. Um, it is there's a lot to be there's a lot potentially to feel uncertain, down, scared, alarmed about. And we all should have our feelings. We should not deny at any point any of the feelings we have. We need to let them be there. We need to let them rise. We need to let them move through us. And then we need to allow ourselves to glean whatever wisdom we can from that experience. At the same time, we're still here. We still have each other. And as long as those two things are true, there is not only hope, there is also potential, and there is also the guarantee of change in some direction. And at least some of that must break in our favor. So, positive attitude, we're in this together. Let's make it happen together.
I love that. We are in this together and we rise together. So let's do that.
Yeah. Yes, we do. And we should.
Well, thank you so much, Dr. Matt, for joining me for another conversation. They're always such great conversations, and
I appreciate it.
I could have you on, every other week on the podcast to talk about something spicy.
There would be lots of spicy to talk about.
There's so much spicy to talk about, but ultimately we want to leave you all with hope. And that is exactly what Dr. Matt just left you with. So thank you so much. And to all of you listening, we are cheering you on in really being empowered in your health to take back whatever you can of yourself, of your own control, to really just live the most vibrant life you can, because you deserve that. We all deserve that. So until next time, my friends, I see you, I believe in you, and I'm cheering you on. Thank you again, Dr. Matt, and we'll see you back here again next time. Bye for now.
Next time.